What's up, Doc Mike? Today's topic for August 21, 2020. The game changer, while waiting for a vaccine. Be the solution sa Barangay of the Department of Health. Presented by DOH Undersecretary Maria Rosario Vergeire. Thank you very much DOH for our musical encore. Jazz Clean Air presents USAHAY, an original Pinoy jazz rendition of a popular Filipino folk song, performed by the Jazz Clean Air Band. Original musical arrangement, Dr. Michael Raymond Aragon. Stay safe.
So today we will be sharing updates on our national behavior change campaign against COVID-19 called the BIDA solution. Next slide, please. So with DILG, we were able to partner with DILG so that we can bring the BIDA solution sa mga different barangays po natin all over the country. Next slide, please. Our major goal is to reach every Filipino, and of course, when we reach them, we like to enable every Filipino, enabling them so that they can have this behavior change. Kailangan din po, pag in-enable natin sila, maibigay po natin sa kanila ito pong mga pangangailangan nila, katulad ng mga commodities, katulad po ng access to water and water facilities, and of course, we like to include in the communities, yun pong ating mga workplaces at saka mga schools natin dyan sa community. So this BIDA campaign would primarily address social determinants of health by having this behavior change campaign in our communities. Next slide, please. So we have identified indicators kung saan po natin ginawa ito. No? So we went to the different barangays where we had an assessment of the different households sa community po. Nag-interview po tayo ng mga households and healthcare workers, and then we had this feedback and planning phase where we co-created solutions with them and the pilot of the community response as well as monitoring and recalibration of the plan. So we have identified indicators. Ang una po, at least dapat may 10 households na interviewed for risk perception and rumor management. So tinanong po natin, ang isa sa mga tanong natin sa kanila, bakit po ba mahirap i-comply ang minimum health standards para po sa ating mga kababayan? So there were also this indicator na at least 3 healthcare workers are surveyed on information needs per barangay. And then we have this, as I've said, co-created plan with local leaders. And 100% of barangay leaders are trained on risk communication. So aside from this assessment, aside from planning with them, we also would be capacitating our barangay leaders. And as we have always mentioned, we are going to identify BIDA ambassadors in selected barangay so that they would be helping us in disseminating information about this behavior change campaign. Next slide, please. So this one is, ito po yung as you can see, there is this young doctor. His name is Dr. Alfonso. And he is interviewing a housewife on her perception of the risk of COVID, what rumors are going around that continue to trigger misconception. So we had this risk perception, rumor management, and information gap survey kung saan nakakuha po tayo ng mga datos para i-input natin dito sa kampanyang ginagawa natin sa ngayon. Next slide, please. So together with the community, we have identified what stops people from doing these minimum health standards, as I've mentioned a while ago. Like why people are not able to follow physical distancing. Like in this photo, for example, makikita po natin kung paano po yung pamantayan at patakaran ng mga establishments din natin kapag pupunta ang mga tao sa mga ganitong lugar. So ano po ba ang mga drivers ng pag-comply ng tao dito sa minimum health standards na meron po tayo. Next slide, please. Then here is the co-creation stage of strategies to make the barangay truly BIDA with the local leaders. So we had our planning sessions with the barangay leaders kung saan they, together with us, have tried to identify the gaps and identified strategies on how we can better address ito pong mga gaps na nakita natin dun sa kanilang community with regard to this behavior change of their community members. Next slide, please. So we also discussed about how to make sure that they are able to take care of both the COVID-19 and non-COVID patients. So kailangan lang pong ipaalala, because tayo po lahat ay nakafocus na with COVID-19, we would want that we would also emphasize on the non-COVID pathway for health services, and that the other health services are also important for our community members. Next slide, please. So ito naman po as support and walk with the barangays. This is just to show them that the barangay level helps us support our barangays as they implement changes. We support and we walk with them throughout this process. So ito po ay isang pamantayan at pagpapatunay na tayo po ay susuporta sa ating mga local governments down to the barangay level para po maipatupad natin kung ano man pong mga behavior change campaign ang meron tayo, at tayo po ay mag-monitor at tutulungan kanila even with resources. Next slide, please. So finally, we are working to enable our community members to step up as BIDA ambassadors. So ito po yung isang napili natin, and we have these BIDA ambassadors and disciplina brigades, kung saan magbubuo po ng mga disciplina brigades ang ating mga barangay para po sila naman po yung magmo-monitor among their community members if they are really compliant with the minimum health standards that we have set para po ma-prevent ang pagkalat ng sakit. Next slide, please. So ito po yung sinasabi ko kanina, we have undertaken this process where our barangays were visited, and we had these needs assessments. Nag-structure po tayo na meron tayong needs assessment phase. In-interview po natin ang households and healthcare workers. Meron ho rin tayong feedback and planning phase where we co-created solutions with them, and then the pilot of the community response as well as monitoring and recalibration of plans. Next slide, please. So this is just to show us the different non-pharmaceutical interventions for minimum public health standards. Hindi ko na po ito ulit-ulitin, pinapakita lang natin na kasama po yan sa pagcapacitate natin sa ating mga localities. Next slide, please. So these are the different issues that were identified. So unang-una po yung complacency. So kailangan lang po ang rekomendasyon, of course, we have to publicize the magnitude of the problem. Kailangan din po yung progress reporting where we can see na because we already know the magnitude of the problem, kailangan in time nagre-reduce po yung mga number of those non-compliant or violators. Para po ma-achieve natin yung compliance, just to achieve compliance, for example, for wearing of the mask, for doing physical distancing. So yung pangalawa po na na-identify na issue, physical distancing, visual cues, and behavioral nudges have limited impact in high traffic areas. So ang recommendation po na napag-usapan with them is to identify these high traffic areas such as markets, yung mga pera padala outlets, and device mechanisms to limit the number of people allowed at certain periods. So we have discussed this with the barangays, and I think this is critical because it is really understandable, especially in these crowded areas, to be enforcing ito pong mga visual cues and behavioral nudges. Although we can try and do it, pero mas maganda na rin po kung malilimitahan natin ang mga numero ng tao na pupunta sa isang lugar for a given period of time. And then the third would be, of course, the stigma can be caused by actions that may label a resident as a suspect or a COVID-19 case. So kasama po dito yung mga pasyente na pumupunta sa mga health center or yung mga pinipick up ng mga barangay through an ambulance. So nagkakaroon po ng stigmatization, nahihiya ang mga tao, lalo po silang nagtatago. So our recommendation here is to revise the barangay protocols to minimize actions that may label as a resident as a suspect of COVID-19 case. So we have to promote the existing DOH mental health hotlines as well so that the families can also consult when they have this kind of feelings, especially when it comes to mental health. Next slide, please. So dito po sa feedback and feedback mechanisms, initially intended for self-reporting of symptoms and consultation, are used to report other individuals allegedly with symptoms. So our recommendation is to maintain that hotline and utilize reports by community members to trigger household monitoring via phone, and to scope for rumors and misinformation. So next slide, please. So ito pa rin ho yung mga gaps and information. We have a whole document for this, but I'm not going to really discuss all of this for now, no, because I know we have limited time. Next slide, please. So next slide, please. So ito po yung kabuuan ng ating binigay na information po regarding our behavior change campaign. So we are appealing to everyone, hindi po tayo dapat matakot sa COVID-19. Nasa atin po ang solusyon kasi tayo po ang solusyon.